next to the Wonder Lake subdivision, which I live in Deer Path. It's also next to Woods Creek subdivision. It is nearest home is less than 1,000 feet from this proposed slaughterhouse. It's hard to get news about what's actually going in, but through FOIA and other information, it is was originally just chickens, but now it is cattle and pigs as well. And again, knowing my background for health and safety, animal carcasses is considered a biohazard, and there are no drainage, there's no wastewater treatment sites in Wonder Lake, at least on the west side. I know on the east side they're putting in the sewers, but there's nothing on the west side for us. They are on top of a hill, and it's right next to the Nippersink watershed. It eventually will get into the soil. So my concern is obviously the health hazard to all these surrounding neighborhoods. The Greenwood Elementary School, where my son currently is attending, is less than a mile from this facility, and the direct winds will blow in our subdivision as well as the school area as well. So I'm very concerned about the school. I'm obviously concerned about our neighborhood and my children. So again, I don't know if this is the right place to speak or not, but I want to get my voice heard so my children know I'm fighting for them, and I've done everything I can to protect them. So again, my concern is waste, biohazard waste. They said they'd put a separate septic tank in for their liquid waste, but as I said, I come from the food industry. I know what it takes to become FDA certified in the chemicals that go into sanitizing equipment. It is not environmentally friendly and has to be treated properly, which I do not feel this place can handle that. It is not just a small farm who's trying to become a slaughterhouse. This is a corporation from a gentleman from Lake Zurich who owns multiple markets in Skokie, Mundelein, and Lake Zurich. The meat will not be sold here unless it's online, which is said is only up to 8 people a week or 8 people a month, I can't recall. So again, I don't know where I'm going from this now, but yeah, my concern is this facility and how close it is to our residents, as well as our septics and our wells. I don't know how much water it takes to clean. So I don't know what else to say. So. I just want to get my voice heard. So, there are many of us who are concerned about this. Our petition is up to, we're 3 away from 700 people. We do have an attorney, and the meeting is this Thursday. So, yeah. So I don't know if the health department can help at all, or if you guys feel it's concerned, but I figured at least should try. So, thank you for letting me speak.
Thank you.
Thank you.
Thank you. Jurisdiction for this type of topic is limited with the health department. The majority of the decision would be made by planning and zoning, the zoning commission, the county board. Yeah. Just FYI.
Thank you. And we definitely reached out to the county board and the zoning commission, but can't hurt for you guys to hear it either.
Yeah.
So,
No, we
I don't
appreciate it.
expect anything else, but I just want to give my voice. So.
Thank you. Thank you.
Thank you.
You know, you're going.
Okay. Do we have?
I just learned that staff is aware of the project, and they will report back to the board.
Great, thank you.
Thank you. Anybody else from the public wish to make comment?
How about these 2 young men?
Okay, let's move on to item 3, the agenda, the minutes. It's been called to my attention, we might need to make a correction that we adjourned the meeting at 8:36 instead of 8:32. Stop the presses.
All right, then I will make a motion to approve the minutes with the adjustment for the April 21st, 2025.
I'll second it.
Motion has been made by Ms. Carmen, seconded by Ms. Clark, to approve the minutes. All those, any comments, questions? All those in favor say aye.
Aye.
Opposed say nay. Ayes have it, motion carries. Item Item 4, employee recognition. We have an employee to recognize tonight.
We do. We have Kelly Beckman, who is our solid waste program manager. And she's here tonight with her mom and 2 boys. And Connie used to work for us. Debbie. Sorry. Debbie and Connie go together. Yes.
We answered the phone.
Yes. So we're honoring Kelly for 20 years. And I know Patty has some things that she would like to share with us.
Sure, so Kelly started actually as an intern before she went to college, and then when she went to college, she came back and did another internship with us. And then after she finished college, she came back and actually was hired as an environmental health practitioner. So she's really worked in every single program that we have, which is actually kind of unique in our division. She's coordinated most of those programs, and currently, and for the last 6 years, as Melissa said, she's our solid waste manager, and she also currently supervises our laboratory. So she's just a valuable, employee of ours, an asset to our division, and she does a lot of things for us on a daily basis and helps keep all of our programs moving forward.
So we are very happy to have her.
Absolutely.
Ma'am. The McHenry County Department of Health proudly recognizes Kelly Beckman for 20 years of dedicated service and commitment to public health. Thank you.
Thank you.
Thank you.
Thank you. Do you want me to take a picture?
Do we get a small? Yes. Right. Okay, we're going to hang out. Let's take a picture.
Congratulations.
I don't know which camera to look at.
Do you want to go ahead?
Aim for the middle.
You want to get on? Or somebody stand on
Love that they're here. So my 9-year-old Sebastian and my 6-year-old Wyatt. They've been part of this for 10 of the years. Thank you guys.
Good job. Support you.
I'd like to say I work with Kelly on the Environmental Defenders, and she's been a huge asset to our team and helping us, work together with the health department. And I don't know if anyone I actually read the whole solid waste plan, and she did it all, and it was amazing work. So I'm very glad that she's here, and she can't leave the health department or the defenders.
Thank you for that. All right, item 5 on the agenda is program highlights, food protection program.
So Patty is going to be our star presenter today, and we thought it would be good to just get a refresh on the food protection program. And Patty's going to review that, and in particular kind of walk us through some of the standardization process for the staff and how we ensure consistency in our food inspections.
Okay, I'll stay here if it's okay. I'll just move over like that here. Okay.
You want me to just move? Go.
Yeah, okay. So our food protection program actually is probably our largest single program that we have in environmental health at this time. And so just an overview of some of the activities that we do is we do all the food establishment plan reviews. That's for any new establishment or one that's going to be remodeled. We do all the cottage food reviews, and actually we have over 100 of those in the county at this time. So that's really takes quite a bit of time and effort. We do all the opening, routine, follow-up, and complaint inspections. We do the inspections and permit the temporary food establishments. We do complaint response, and particularly specific to illness investigations, and then we do public education. And just a reminder, all of our food inspections are done electronically, and those reports are available as soon as they're completed online on our website. So this is just kind of the numbers from last year, about 1,500, just under 1,500 food establishments, another 1,000 temporary food events, We did 6,455 inspections, food-related inspections. We responded to 332 complaints, conducted 195 reviews of new establishments or remodeled ones, 125 cottage food reviews, did 2,247 consultations, 8 virtual office hour meetings with 514 participants from our food operations, and then 8 public education events with a total of 1,900 participants. So we do reach really a lot of people, and it is a very active and busy program. So Melissa received a question about, have we canceled our virtual office hours or that we had canceled a couple of those, but we haven't. We did have to cancel one, but these are the topics that we've covered. We do one every month, and from last year we covered issues such as the required documentation, so policies and certificates operators have to have. We went over more than one time the 2022 FDA Retail Food Code changes because it incorporated quite a few changes, particularly in terms of labeling and allergens. We went over plumbing and physical facility maintenance, sanitizing procedures, cleanup procedures for illness events. Those are primarily customer illness events, which unfortunately do happen. What's in a label, to go over chemical labeling requirements, and then menu requirements specific to consumer advisories. So we choose these topics really based upon the trends we're seeing in the establishments, at that given time. So if we're seeing like a large frequency of one type of violation, we try to kind of group together and then do an education to try to address it holistically there. So we do have standards that we have to meet for it. So as a department, we meet the Illinois Department of Public Health protection standards, and we're reviewed every 3 years. They look at things like our ordinance, our inspection frequency, our follow-up frequency and timing, whether or not we are actually citing the correct citations, what type of public education we do, and they look at the plan reviews. From a food establishment operator standpoint, there's the 2022 FDA Retail Food Code, which is quite the document, has a lot of things in there. But also we have the Illinois Department of Public Health 750 code that applies to all of our retail food establishments. And then within our own ordinance, it would be articles, a typo, sorry, it's articles 1 and 3 of our local health ordinance. So there's a lot of regulations, standards, requirements that apply that our staff has to be familiar with, and more importantly, our food establishment operators need to be familiar with. So I wanted, though, to speak to, what we do to facilitate consistency among our inspections and our inspectors, because I would be honest with you, it's the #1 concern that we receive from food establishments. So I will sometimes get a call that says, I was cited for this, but the last person did not cite that. The last inspector didn't. Or the last inspector said, that was okay if I did that. So we do receive those types of concerns. So I just kind of wanted to go through the training protocol and our standardization process to kind of give you an idea of the effort that we do put in, so that ideally we'd like every inspection to be exactly consistent inspector to inspector. Not sure that's possible, but we strive for it every day. So our training protocol, when we hire a new staff member, first of all, they start by just shadowing our existing staff. Simultaneous to that, they're becoming familiar with and studying the relevant regulations. And as I said, it's not something you can memorize, but you do need to be able to recognize what is a violation, and then when you observe it, to connect that is a violation, and then how to cite that. So it does take time. Then our new staff has escalating involvement in partnered inspections with our existing staff. So then they become more and more responsible as they're going through to lead those inspections with someone overseeing to make sure they're correct. Before they go out on their own, they do a series of standardization inspections with our field staff supervisor. And what we try to do is we get them going in our simplest first, right? So if you're going to do independent ones, we start small and we do, our category 3s. Then they graduate, I guess is a good word to say, to our category 2s, and then eventually category 1, which are more complex facilities. And it takes about 5 to 6 weeks, for this to happen. So, we do spend time getting them acquainted with that and try to give them the training that they need. And then after that, we do standardization exercises with the food program supervisor, and our goal is to do 4 times a year, but I would tell you we typically get 2 times a year probably. But we try to go out there and we do the same thing. She will go out and do a simultaneous inspection or concurrent inspection with our staff to make sure they're citing the right violations and interpreting correctly. So in addition to that, there's other required training that each one of our staff has to do, and it's required by the Illinois Department of Public Health, and it's provided by IDPH, FDA, and the CDC. So each year that they are employed, they have certain training modules that they need to complete. So in the first year, in addition to our training, they have to learn about public health principles, microbiology, communication, regulations, citing the violations, and temporary food. And then the second year, they get into foodborne illness outbreak investigation and more complex processes. And then in the third year, they want them to kind of get to the point where they're doing environmental assessment. And so in addition to that, they have to have a minimum of 5 hours of continuing education annually. So it's something that we're working on really all the time, you know, to be sure that they know how to cite the violations and feel comfortable citing those violations. So for supervisory support, you know, we're set up such that we have staff that primarily work in the food program. So every day they meet with the food program supervisor for about 15-20 minutes. They're assigned, you know, inspections for the day. They discuss any of the issues that relate to those, and she will provide guidance to them if there's any special circumstances. Every other week they do meet as a group, and they discuss any updates that have come out. They share their inspection concerns, and then they also look at those trends. So that's another opportunity where if someone has cited something or they weren't sure how to do something, they look at it as a group, and then they walk away from that meeting as a group knowing how that will be cited by every inspector that we have. So also in addition to that, we get a lot of questions in the office, so they have access to the supervisor via their phone every day, and I'm in the next door office and I can hear how many times they're calling. So I do know that they are utilizing that and they are, you know, receiving that guidance. And then for weekend work, which we do a lot of weekend work in food, they have access to our on-call staff every evening or weekend for those inspections. So they are always have the ability to contact someone when there's an interpretive question for a requirement. And so basically it's set up such that, you know, they're conducting those inspections, and when we have questions, they're funneled up to the more experienced supervisory staff. And then if there's a question they cannot resolve, then it comes to me. And, you know, we do try to expand this consistency issue onto the regional and state levels too. We do participate in the food subcommittee of the Northern Illinois Public Health Consortium. They do have quarterly meetings to discuss all types of issues related to food. And then when there's questions, I tell you sometimes it's just something where you want to contact another county and say, have you seen this and how are you handling it? Because we do not want someone that's operating, you know, 10 miles over there in another county to experience it differently if it's a universal food protection principle. So we do that. We do participate every month in the IDPH virtual office hours. That information is shared with staff. And then we do often have to reach out to FDA staff for their interpretation and guidance as well. So we try to take advantage of that, you know, as much as we can to ensure that we're interpreting everything correctly. One thing I did want to point out is to really how the FDA Retail Food Code is set up. And when we adopted that in 2017, I'd say prior to that, we certainly reviewed processes in how food was handled, but it was more of a, you know, a checklist that you would go through, and if you see a violation, you know, you would mark that, which is of course appropriate. But with the FDA Retail Food Code, it's really the risk-based food inspections. So the idea with that is that when you go in there, you're reviewing those processes that are happening and that are there right then. Ask a lot of questions, review those processes, and work with the person in charge to really have an understanding. So not every inspection will be identical, right? And even in our high-risk food establishments, we're in there maybe 3 to 5 times a year. That leaves the other 360 days a year where that days of the year where that person in charge is still responsible to do the things, you know, that are required to do. I would tell you it has been an adjustment both for our staff and for food operators, this, you know, switch over to this type of inspection. Because it's easy for people to concentrate on floors, walls, and ceilings because, you know, you can see it right there, you can see a hole in the wall, you can see that, that's it. But the more important things and the more substantive, you know, processes that have an impact on whether or not food is safe for the public really involves the processes, food handling, hand washing, and all the other, you know, temperature control and all the other things that go along with that. So finally, I just wanted to finish with, you know, what happens when we get a question. And we do get questions, you know, we do get questions. So the most common one would be is that Christine, who's our food supervisor, or I will receive a phone call or an email to say, hey, this, you know, this was an issue or I don't understand it. And to be honest with you, I really try to get the operators to focus on, how, not so much how was it marked last time, but is it a correct violation? So I always say if I were marked in violation of that, the first thing I would do is go to the code and I would review that to see if they think it was written correctly, interpreted correctly, and cited correctly. And so, that's the first step. When we do have errors, and we are not perfect, and we do have errors occasionally, then we go back into the inspection report, we make a correction, we document internally that there was a correction made, and then we review that with staff again, so that going forward, we're all doing it the same way. If the food operator does not get satisfaction at that level, then there could be that formal appeal to the public health administrator. We have had a couple of those in the past year, certainly. If they don't agree with the public health administrator's review, it goes to the Board of Health Hearing Committee and then ultimately, here to the Board of Health. Melissa asked me just to give you a couple examples. So I'm just going to give you my personal experience. Actually, within the last month or so, I was asked to go out to a food establishment, and one of the issues that the food operator had was that food beverages, so employees can have food beverages as long as they're stored and will not contaminate food. So the question was, how could one inspector say that I was told I can store it right below on this prep shelf, that's not going to be a problem? And so then the next person comes in and says, no, there's a problem. So what was missing in the conversation, though, is that it can be stored below food contact surfaces, but it also has to be stored separately. So when you're storing, like it was the case, the food equipment and everything directly next to it, it has to be separate and below. So it's sometimes those are the connections, that we're missing. So, we pointed that out, and, so there is some discretionary, decisions and everything made all the time. And then I guess the other one I would share would be one that Christine just recently had with a person who was so frustrated because they had been written up to provide a consumer advisory, for undercooked food. So bless his heart, he goes out and he gets the consumer advisors, they're all posted on the, where they should be, and he gets cited again for the consumer advisory. So his frustration was, there was just a disconnect because the consumer advisory has to match the menu. And so when you have an undercooked menu item, you have to asterisk it or somehow show that that is an undercooked item to then tie it back to the consumer advisory. So those are really, I'd say, the more common, types of things that we have. So we have discussions and we move forward. But I just wanted to assure you that, we're working continually, to ensure that our interpretations, are consistent, to minimize frustration. And we just want any food safety concerns mitigated. So, yes.
On that example, would that not be included in the public report then if that was a misunderstanding?
Yes. And so part of it can come down sometimes to, so when we write the report, we're giving a citation number so they can reference it. And we're citing what the actual violation would be. And then we're putting in what the observation is. So sometimes it could be that the observation was not clear or was not, complete enough to tie it back. But we do try to do the inspections where we're walking with the person in charge and we want to have those conversations, so we do try to do that. But yeah, that can be it sometimes, is that it wasn't, stated clearly enough to tie it back to the
Sure, but I mean, if it's written, I guess what I'm asking is if it's written up originally and they were cited, that's part of the public record for someone to go in and look and say,
That's correct.
Do we modify that so it's removed from that report, or?
If we make an error, then we will go back in and we will correct the report and we'll provide them with the corrected report. If it's something where there was a violation and it was correct, but it then has been corrected, then we mark that on the reinspection that it was corrected, so that's not shown that it's outstanding. So there's kind of a couple ways that could happen, but yes.
Do you get a more, I'm assuming, I don't want to assume, but I guess I'm assuming that most of the disparities are between the restaurant and their understanding of what the violation is, and not because somebody came in and said, no, you don't have to do that, and the next person says you have to do that. I mean, that's probably minor, right?
I would say that's definitely the smaller percentage of it, right. But I would tell you that, when someone is looking at a situation, and if it's procedural, there is some type of, professional discretion there. And so what we're trying to do, actually, to kind of reduce those types of concerns is if we have a conversation with the food operator and we say, okay, you can do this, and we're trying to follow up with an email. So when they call next time, or we look in it, then we'll say, well, let's just see what was said and then we can reference it. Because then it's easier to resolve any type of misunderstanding.
Thank you.
Yes, sir.
Question for you. I had a different thought, but that actually spurred a new one. Is there, I mean, if you're talking about documenting these things, because that's so frustrating, you know, for both sides to come back to something later on and be like, what did we really talk about? Is there any thought about moving to body cameras for inspections?
We have not had that discussion.
I know it makes most people uncomfortable, but I mean, we see it in public safety and it is illuminating where you have one person says one thing, one person says another, and it's like, let's play the tape. And it's very interesting. Okay. My second initial thought was about the only, my entire time on this board, of which I have served on the hearing committee, the only one that's ever come to me, or I think that I recollect, I think it was one, was something we got sorted out, but one of the concerns expressed was communication between the health department and the complainant. And how would you rate where we're at now? I know that's a little bit in the past. Do you feel like?
Yes, so I think that our communication is actually, pretty good. I would tell you every day, every single environmental health practitioner is responding to emails and providing responses, and they're on the phone. So we are happy to do that. But I would tell you that we just always have to work on that situation when it's person to person and you're just trying to express one thing and they may not understand it, so that we will always have to work on. But in terms of responsiveness, they respond to those every single day. We try to get to everything within 24 hours, and most of it's email now, so it's easy to track.
Right, right, so benefit of that. Well, I just want to applaud your division and all the modernization and everything we can do, moving to online, the portal for permitting and everything like that is outstanding, so thank you.
Appreciate that. Yes?
What's cottage, you had a cottage,
Oh, sorry.
what is that?
Sure. So cottage food operations are, there is the cottage food law in Illinois, which allows people to make food actually out of their home if they meet certain criteria. So they have to register with the local health department in which they're located. So we have about 110 to 120 right now, which is a good number. And then they can provide their food in a variety of ways. And so we have to review it to make sure that their labeling is correct, that we understand the ingredients, that it's actually a process that is allowed, so there's a lot of discussions about that.
And then you said there was 330 complaints. Is that average? Is that a lot?
No, that's about average. I would say about 300 a year. Right. And so some of those are illness related, but the majority of those would be, someone probably reporting mishandling of food or some other, negative experience.
You said you were aware of this gentleman's concerns, and you and your department, and the development of a slaughterhouse on the property.
Yes.
What is it that you and your department will be overseeing with respect to that?
Oh, sure. Okay. So our role is limited to water supply and sewage disposal. And
Water supply and?
Sewage disposal.
Oh.
So as Mr. Freddie indicated, it's not served by municipal sewer. They utilize private sewage disposal systems. So we have multiple layers of protection in there for these types of facilities. Special waste holding tanks. We oversee also special waste holding tanks when they're installed. Only domestic sewage goes to the private sewage disposal system. I'd be happy to provide detail.
And we monitor that on an ongoing basis.
For a facility like this one, yes, because they are required to separate the processing waste in terms of the slaughter with the domestic wastewater. So yes, we do oversee those. But we don't, if we have a retail food permit, if he does any work out of there, for a retail food permit, then we would see that and monitor it additionally.
Do you monitor the water, the well water that people are getting in the aquifers because of this?
So,
secondary.
sure. So just because it is a non-residential facility, not necessarily, but there is a trigger for our non-community public water supply, which is serving 25 or more people at least 60 days a year. So if that were triggered, yes. So we have about 300 of those within the county that we monitor, and we do routine inspections, biannual routine inspections of them, and monitor their sampling frequency. I do not believe this facility will rise to that level at the original proposal.
But I read that they're trying to include cattle and pigs because it's so expensive for them to just get certified for chickens and poultry or whatever. And so what do you think? I mean, I know we don't inspect them, it's the USDA, but I guess bigger picture, if there's cuts with the USDA, is that going to be a problem for McHenry County in your department if they're not being inspected?
Sure, so they're inspecting specifically the processing of the animals, right? So that's still separate from the portion that we would do, which would be the retail food, if it applies, private sewage, potable water, et cetera. So I don't think it changes from McHenry County Department of Health what our responsibilities would be. But I hope that's not the case, that it's.
Would the citizens be able to request a water testing,
Yeah. So yes, we do respond to any concerns of contamination and respond appropriate to what that concern would be, right? So I'm not sure, in this case specifically what the concern, would be. So if someone said, I'm concerned about the bacteriological quality of my water because of A, B, and C, yes, we have the ability to get that. We have our laboratory, we would run it internally, we would do that. And then if we, document any concerns, we'd follow up accordingly.
is there a cost to the citizen for that?
Well, we typically do not charge a cost when it's related to a public health concern specific to something. But yes, when people bring in their samples, which we had just a huge spike in samples last month with the sale we had, then those are, just the regular fee for service.
Let's segue back to the food, the cottage food. It's funny you mentioned that, because I realized I was looking at a bottle of barbecue sauce I bought from a food here in McHenry County, and it was a cottage permit and had our number on it. It was kind of cool. What kind of inspections do we do, like at their home, do we do that 2 to 4 at their home?
We do not do any inspections of cottage food. So we review upfront what those foods are that they're going to prepare, and then generally how they're going to prepare them. If they meet the standards of that, then they're exempt from the permit. So we have the ability, if we got a complaint specific to that, to conduct an inspection. We've never had that happen so far that I'm aware of. They do, in that case, though, if they're on a private water well, have to annually provide a water sample to us as part of the registration renewal process. But we're doing it internally and providing the guidance. And then we do see them out and about at farmers markets and things like that. So if we saw a problem, then we would, follow up with them.
So just to be clear, if I want to open a barbecue operation out of my home, I'd have to register annually, and then part of that is the water testing that I'm serving or I'm using. But other than that,
right, once the approval is given, it is given specifically for the foods that you've provided the data to us on. And then that's what the registration will show. They are approved to provide these specific food items, and then that's what is allowed. Now, if let's say you wanted to up your game and you wanted to, add something else, then you'd come back to us and say, I want to revise it, and we just review that in addition.
Do cottage industry people, I'm part of the Dane County Farmers Market, so I know the criteria for all of that. Are they required to label their products that may come in contact with peanuts, even if they don't process with peanuts because it's outside of the normal commercial kitchen?
Yes, they still have to label all the products, and then in addition to that, they do also have to provide a placard there that, or to put on there clearly that these are not produced in a kitchen inspected by, the local health department. Thank you. Verbiage, something like that. Okay.
Thank you.
Anybody else? Okay, I'd like to take a minute to make some comments. I asked for this slide to be put back up, identifying the amount of work that was accomplished by environmental health departments employees last year. So often us as the public assumes that the workload is really when somebody gets sick or an infection happens or the beach is contaminated. And the media picks up on it and reports it and it's like, well, okay, well, that's not a whole lot. Then when you look at this and see the volume of work, and this is just in one area of the environmental health department, that they accomplished in a year's time. It is remarkable what the employees get accomplished. And I always wanted to express our pride in the employees for making this, and please extend our appreciation to them.
I appreciate that, I really will.
Okay.
Sure.
Thank you.
On that note, and something we've discussed before about one thing I think we don't do as well as we could is marketing ourselves. Like, we're just kind of, public health often, just, you got clean water, you got safe food, right? Don't even really realize what goes into it. Are we publishing this along with, we send out, with our public information officer, we send out email and social media blasts about stuff. Like, what do you think about putting this out a year cap? Here are a couple of the faces of the people that perform these inspections. All this is done on the backs of these few number of people.
Sure. We do include it in the annual report, which would then include the other numbers and all the other program areas. But yeah, I mean, we'd absolutely be interested in that if that's something, that Melissa would
Yeah,
like
and
to
we, as part of recruiting, we do have some videos of staff who do the work, right? So we've got some environmental health practitioners, but it's an excellent point. We are starting to build we're at the very early stages of sort of some internal, having each division begin to develop some materials about what do we do? What does it mean to be public health? We presented one last week at the Cal about epidemiology. Like, what do the epidemiologists do? Because really we find that people don't know what we do. And Patty was one who worked closely on a foodborne illness outbreak investigation explanation. So we're gonna package that stuff up, and Megan's gonna start doing some of that because as we go into the budget, or just to help educate the public, like people really still don't know. Public health's been around for a really long time, but people don't have a solid understanding of what we're doing and what doesn't happen as a result of what we're doing.
I would love to see something like almost continuing education for the public to increase our brand, spread awareness about what we do here. Every division, just a little snapshot. It's one thing to throw all this into a year-end review that we get, and it's a beautiful thing, but it's a lot to digest. And if my neighbors, eating Cheerios in the morning and they're on their phone flipping by, I would love for them to see that, hey, maybe not Cheerios in this case, but they're eating some leftover food from a nearby food establishment.
Barbecue sauce.
Yeah, barbecue sauce. That would be really outstanding.
In reference to the food establishments, in this volume of work, where does the funding come from to support this?
Yes, so we receive funding through the Local Health Protection Grant. And then we have the permit fees that are generated for our permits, which, and between those two, that's intended to cover our, direct costs. Right, not all the indirect costs associated with, with our direct costs. So when we look at fees and evaluate them, that's what we're taking into consideration.
Okay. In the grant, where's the grant?
It's the Local Health Protection Grant that it covers, food, sewage, water, communicable disease, and community planning that we have as part of being a certified local health department.
Thank you. Anybody else? Good, okay, we'll move on. Good presentation.
Thank you.
Patty, quick question, just to this gentleman's concern. You and your department will be periodically
Oh, sure, I'll talk to him after the meeting. I'll be happy to talk to him.
checking on the slaughterhouse and what it's doing. And
If it receives.
if they have a concern, do they come back to you?
Related to what is within our authority, right? So the private sewage, potable water, those types of things, solid waste, this would be another yes, absolutely true.
Did we answer your questions or concerns?
I have a lot of questions. I
And Patty is.
can talk to Patty afterwards, if that's okay.
Oh, sure.
Okay, item 6 on the agenda, department and division updates. We'll start with Administrator Adamson.
Okay, I know Kelly left, but I wanted to say, so Kelly does the recycling events. I was there on Saturday. It was cold and windy, and she did a great job. And the whole team, we had other staff who were there. And, you know, it's a lot of work. I encourage you maybe sometime in the future to volunteer. I know you guys volunteer, but, you know, it's a good opportunity to see how everything works. The defenders were there. So I just wanted to congratulate her on a great job. And then we also did the Touch-A-Truck, and Megan's team was instrumental. They were staffing the booth. I popped in, so that's where like trucks from, like big trucks from, I don't know, a lot of municipalities, our Department of Transportation, they're the ones that post it and put it on in the Farman fleet. So that was fun. You see a lot of kids around. The kids who were in the police vehicle, wow. I think they didn't realize that it amplified when they were yelling into the speaker. So it was loud when I got there. Anyway, that was fun. Just a friendly reminder, application deadline for the Board of Health has been extended to June 12th. The renovation update in Crystal Lake, so if you've driven by, you're gonna see you're gonna start to see the demolition. So the interior demolition is underway. Demolition? Wow,
You got
I didn't say that right. On the clinical side, including all the electricals getting roughed in. The trenching has begun on the new foundation, and forms on May 14th and foundations have been formed and set. The HVAC and roofing materials are due to go in this week. Infill masonry on exterior walls has started, and the backfill on all the new foundation will begin in later this month, May 28th. So this is all weather dependent, so things can change if anything. You know, we're not having great weather right now. Quick legislative update that I got on Friday. So remember, there was a TRO in place with all of those funding clawbacks. So some hopeful news. I don't want to get too excited though, although it is kind of exciting. The Rhode Island federal judge posted her ruling last Friday. She had asked for a lot of materials, which she reviewed. The court granted a permanent injunction that requires the federal government to treat any actions taken to terminate those grants as null and void and rescinded, and the federal government has to take immediate steps necessary to effectuate that decision, including clearing any administrative, operational, or technical hurdles. However, there is they have 30 days to appeal. So I don't want to get too excited because I would expect that they're going to appeal, but it is hopeful that upon that review, someone said, hey, wait a second, you can't just claw back these funds. So I feel like we're back to wait and see, and we should be conservative. And if we can continue, again, most of that work is mandated. So in terms of staffing time, I would feel comfortable that once this gets resolved, if it is in the favor of public health, that we can request reimbursement for staffing time, and then we could resume the activities such as media campaigns and things like that. But until then, we'll just be in a pause. And other than that, just the financials are, if anybody has any questions, you can let me know, but I don't really have any updates about those other than they're pretty straightforward and we remain on track. Budget, I did say this the last time, so we will be at the June Cal meeting, the county board will be starting the discussions about the 2026 budget. So they're starting a little bit early because they really want to provide direction to the staff about how we are to proceed with our own departmental budgets. And that's all I got.
Questions from the board? Okay, very good, thank you. Director Noel?
Yes, just one thing. For the past, I think, several years, I've kind of said a couple times how we really were having trouble filling our environmental health practitioner spots. So I think this week we're finally in a position to fill our open field positions, in which case we'd be fully staffed with environmental health practitioners and health educators and, health inspectors. And I can't tell you how excited I am to be able to say that. It's going to be a good thing moving forward, so that's all I have.
Congratulations.
Thanks.
Questions? Thank you. Director Howell?
Okay. I understood that some people may be interested in the number of dangerous or vicious dog cases we have going on. So we have 7 active dangerous dog cases. That could be anywhere, right, from insufficient evidence, potentially dangerous, right? And then there's your vicious. We do have 1 case that will be filed in court this week for a vicious dog. Obviously, the court makes that final decision. It's our recommendation. And we made some recommendations for what would happen if the dog was deemed. But that will also be up to the courts to do that. There was a very severe injury to the face. So we felt with that kind of injury that we could not seek the vicious dog. We have been working with, Ryan on mapping our bites. So you probably saw in the health atlas that there are bites mapped, but we're trying to get back to 2018 through 2024. So we have all of that mapped, and maybe we'll be able to see a little bit more trends in there, look at some of our other data as far as age categories, extremities of the body that were bit, those kind of things, and see if there's more education we need to do someplace. You probably saw the press release that came out about capacity. That was at the end of that press release. Capacity means that we are trying our best to keep 15% of our cages open. Because remember, we have stray animals that come in, we have animals confiscated by law enforcement, maybe somebody's been in a car accident and they had their 8 animals with them. So we have to keep some spots open for those types of situations. Last week, there was a little bit of a panic because we were waiting for an owner to come pick up their stray animal, and we had another stray animal coming in, and we didn't have a cage to put them in. So, but that did work out. And now, I have no wood to knock on, but we do have a couple of cages open in our dog intake area. Let's see. You probably saw that press release as well. We're not really cutting back on services. We're just encouraging people to do things online that they can do online. And then because of all the construction, if you've been in our parking lot, it's getting pretty tight. This morning I counted 15 construction vehicles, not including the backhoes and all of that. So we are getting pretty tight over there with all the different type of construction that's going on. So we're trying to get people to come in the back door and not have to worry about going in the front, because they may be pulling a vehicle through, there may be a semi in there taking something out, and we just want to keep the public safe. But they can still come in the building. We're just encouraging them. Anything you can do online, please take care of it that way. So, I think that's all I have.
Questions from the board? Could you briefly make comment on the new sign program?
For the new signage, yes. So, remember our ACO went through Animal Control Officer Training number 3? Well, one of the recommendations that came out of that was designing signage that you could put near where a stray animal was found. So if an animal doesn't have a microchip, how are we going to find the owner? We do put them online, we do put them in different places with other organizations on Facebook, but now we're going to start putting a sign where the animal's found, as long as it's safe, that tells them the type of animal that was found and where they can call to try to get animals back to their owners, according to Bridget.
I saw that press release. I think it's a great idea. My question was, if you say, hey, this dog was found here, it was this type, this breed, someone calls in and says, that's my dog, what kind of verification are we going through?
Typically, they're gonna have to have the rabies vaccine certificate in their name or some other vet document that has their name on it.
Okay.
Right?
Yeah.
Yeah, there's verifications. that
Perfect,
happen.
that's all.
Sometimes we even look at their Facebook page. Do they have a picture with their dog?
Yeah, exactly. Like, oh.
It works. If you're cuddling that cat, it's probably worse.
They may not have pictures of their children, but they'll have pictures of their dog.
There's a reason for that too.
Very good, there's a good reason.
Any questions, more questions? Thank you. Director Marin?
Oh, she is not here
Oh,
today.
I'm sorry. Good observant. Behavior of myself. Okay, Director Hack.
I just have two really quick updates. So just letting you know that Bridget Hoffman, who's our ER coordinator, and Chrissy Wasson, who's our community resource coordinator, both presented at the National Preparedness Conference on Operation Dropbox about how we managed to turn this required exercise with our MRC into like this huge community thing. So I was actually there too and was at their presentation, and there was a lot of people attended it and had a lot of questions. So it was really positive, I think. And then Bridget, back to back, had to go to the IDPH state conference and presented there also. So she was gone for 2 weeks at conferences, poor thing. And then the last thing I just wanted to say was that our update on our community health assessment is that our community survey is out. So that, just a reminder, that only goes to like a random representative sample. So not anyone can just take it. And so if you get questions, you know that you can tell everyone that that survey is legit. They should fill it out if they receive it.
Question?
Great to hear about their presenting. I gotta say, you gave me a little scare there. I heard the two names together. I'm like, oh my gosh, if they resigned or something, I'm gonna,
No,
I was thinking the same thing.
I'm gonna cry.
I was thinking the same thing.
Get it?
That's it. Lupe leaned over and said that, like, we had this shared moment. I was like, no.
You're not going to have to wait for the end, or at least the middle.
Director Bennett?
Sure, so I just have a little epidemiology update regarding the respiratory status. So just in general, the respiratory season this year was worse this year than versus last year. The influenza ICU levels are slightly above baseline, but nearly on baseline and on their way down, so that's positive. As far as respiratory status for the 0 to 4 age group, it's been higher than it usually is, but overall moderate. So influenza is moderate, RSV is moderate, so we should be dropping to the low status. We're in a good spot for this respiratory season. And then IBCCP, we got notification that our grant is being renewed. We're getting our award again for 2026, so that's positive. I know grants being what they are in this current climate, so we were happy and thankful for that. And Felicia, who has taken over the coordinator role there, is doing a great job of making connections within the community and building relationships with different community partners and working to increase our numbers with the Wise Woman program. So she's doing a great job over there, her and her team. We're very thankful for them to be over there. We have 2 nurses that are working on their Class C licenses to drive the mobile clinic, and we've kind of been working and collaborating with other entities within the county itself and getting that out there. We did just do an immunization event. So it's kind of a trial and knowing where to go, when to go, and when to be there and getting people to come. So we're kind of working through that and building together a team to collaborate among both community health and nursing for all of the relative parties to get involved in having a conversation so that we're utilizing that the best we can. That's kind of all I have. Yeah.
What is the status of measles in the county?
Measles. So we have not had a measles case yet in the county, which is good. That's positive.
That's
Obviously,
great.
we know that there is measles in Illinois. We have sent notification to a few schools. So IDPH put out a web page that allows you to look to see what the measles percentage is for immunization. within certain schools, so people can search that, that's public data. There are some schools within our county that were under where they should be, and we did send out some information to them. We are gearing up with our different information and have reached out to urgent cares and to emergency partners. Kind of, there's been ongoing discussions and preparation is what I would say, but there have been no cases in McHenry County at this time, and we'll be hopeful it remains that way for the foreseeable future. But in the event that we were to have a case, we are prepping for a response.
I was on that website and I noticed that some of the schools farther west are below herd immunity.
Mm-hmm.
Do they have a particular bunch of religious people at that school? I mean,
I think that there are certain schools that people go to those schools for a reason.
Oh.
Like there are some private schools that had some lower levels. I mean, I don't want to speak to why they would choose to do that. I just presume there's certain beliefs that had them at that school. And I don't know that, I think we're in a special spot regarding immunizations right now that I don't know that I'm changing their mind. All I can do is provide the education and we can encourage, and we're sort of working, the immunization team is working to kind of get out into the community and make some more connections within the different school districts as well. Because
just strengthen, well, not just, but in the last several years, didn't they strengthen the laws regarding religious exemptions? You have to have like a letter from McMaster or something.
you have to have religious exemptions, but there's religious or medical exemptions. I don't know that people are, that doctors are fighting against signing those. I don't know. I can speak to, we did consult Dr. Tomaso before about people having exemptions and what those exemptions look like. I'm not sure.
I don't think it has to be a
pediatricians that are doing this.
I don't think it has to be a physician.
For medical?
I thought that they had, when I was working at Community Health Partnership, I thought they had strengthened the law to say that you had to have your pastor or somebody sign the letter.
For religious exemption?
We have, well, for employees of the health department, the attorney signs the religious exemption and I sign the medical exemption.
I'm not sure about this valid.
Yeah.
What's the percentage, 90, I think, was it 90%?
For the school, the medical director of the school would sign
What is it?
I believe it's 96.
the child
Between 92
exemption,
and 96.
Which I know.
not the school nurse.
But I think I know one family.
No, yeah, I know, but I thought it was the pastor or whomever your religious leader is, God or whatever, has to sign a letter saying that.
I'll go to that meeting.
I know for certain that one family in our district had their chiropractor sign it, and it was accepted.
Jeez.
See, so I think that there's not really
In the
some
public?
continuity.
In a public school.
So
medical?
my question about that would be, is there any follow-up that we do? I don't think we're necessarily the authority on that. We're not there to review their documentation or anything like that, right?
No, I mean, we can encourage
Yeah.
people to get immunized, and I can provide education regarding immunization.
Sure.
But I think that these people have cognizantly chosen not to be
Sure.
vaccinated and not to vaccinate their kids, so.
I'm just grateful that this particular illness, the vaccine is so very effective.
Right.
that
In McHenry
it's-
County, just from my patient population, it's not a huge issue as it is in other communities.
But even,
reassuring.
no matter what community you're in, I'm just grateful that if my child is vaccinated, the protection is predominantly there. And
But herd help.
herd absolutely helps, but this is one of those where it was like more than COVID, more
Right,
than some other
right,
choices.
sure.
It's tough, but I don't, it's a special time right now, and we need to be proactive about education and what we do here, and where does the science, and
Yeah, so we're targeting those schools as a starting point,
We did
That
send
is
at least
lower
some
than-
information.
where they need to be
Mhm.
to achieve herd. And then if we were to get a case, we have, quarantine, isolation, and exclusion available to us.
There was a law, Illinois, I worked with the Illinois State Medical Society, and we were trying to pass a resolution that said, there was a resolution passed that said, if there's a religious exemption, that the physician was then required to provide counseling along with that religious exemption and sign that religious exemption. And some doctors liked it. I at first liked it, and then I disliked it, because then we were sort of condoning, I felt that it was a condonement in some way.
Yeah.
So,
The council is nice, they use that in other things.
yes,
But to your
but,
point, are you changing these people's minds?
I mean, I would like to say there's probably a sweet spot of people, like a certain number of people that maybe don't have the education, maybe weren't sure, maybe they had some hesitancy about some other things that some information could get to them, but I think the predominant number, especially if they're attending those specific schools, they're going there for a reason.
Yeah.
I think people
They're
don't
not
understand
immunizing because they're choosing not to
how long they're
immunize.
gonna be off of work with their kid at time. You know, is your work gonna give you 2 weeks off? Or 3
it doesn't, sometimes it doesn't take much. I mean, I had a family in Rockford a few weeks ago, and, you know, there was enough hysteria, just that the child had a fever and a rash, that I said, bring the kid back right away, and you know, we got the health department on the Winnebago County, got the health department on the phone, and then I said, so, and please do consider, that I said the health benefits, and she's, oh no, we're definitely gonna get it, now we're gonna call the pediatrician Monday morning. I said, oh, well, that's great. I mean,
Yeah.
and it wasn't even a concern, because, you know, they said, oh no, there's no measles in the county, and the family had not left Rockford and everything else. So, I mean, just enough there,
Yeah.
so.
That made it very real to them. Sometimes I
Right.
think that you need to make it real for someone to see it. To be, I don't want anyone worried that their child has measles.
Right.
To get them immunized, but maybe if they see it like that.
Yeah.
Just a reminder too that, you know, all of us who have gone through COVID and had to deal with, you know, there's different beliefs out there. If we take a stance that internally I'm very frustrated with people, but if we take a stance where they feel like they're belittled or they're
Right.
alienated, there will be no
progress.
you don't win hearts and minds through those actions. So let us always conduct ourselves in a way that helps to encourage them to make a choice that, you know, that's based on science. And remember that they're getting their information sometimes from sources they think are reliable, but, you know, in their own lives, they think they're reliable, but they're not, right? You're getting your information from your neighbor. That's not the same as the divisional director of nursing or one of our health educators or a physician or something who can bring more, you know, gravity to the situation. So thank you for your all of your efforts on that, and it's tough.
We're working with community health also in preparations. Yes.
So if there was an individual in these schools with low immunization numbers who developed measles, would we be able to then offer immunizations to those students? And if we did, how long would it take before they developed enough immunity?
If you get them within 48 hours of exposure, I think like within 48 hours of them having that contact, so it kind of depends on the window at which they were exposed as to how much time you have to then do the immunization itself. But like, and you can tell me, like,
If it's an exposure, or if the child comes down with measles?
she's saying they were exposed at school to a child that tested positive, but they're in a school with a bunch of other unvaccinated children. So then the unvaccinated kids had an exposure. So you do have some level of opportunity. Is that what, like where we're going with this? That's kind of what I heard you were saying. We have some opportunity then to provide vaccinations where they could possibly then avoid infection.
It takes at least like 10 to 15 days before the antibodies are produced. I mean,
And what level of protection does that provide?
yeah, it takes a lot
You'd
longer.
also have to know like pretty quickly that they were exposed and then
Yeah,
they
I mean,
have
we
to be
can look it up
vaccinated.
right now. I don't have
14 days, you
at
said?
least, I mean,
For antibodies, yeah.
I don't have them all memorized, but we can look it up.
I don't know. Yes.
Is it public record what percentage of students are vaccinated within that district?
It's public record. On IDPH, they have a measles dashboard. You can
Wait,
look
I
and
can send
see.
you the link.
Right, but like what I'm saying is there education like that to parents I think
That
that
their school has a.
if their
lower
school
level.
has like a lower number, maybe that would encourage them.
But isn't that why they're choosing the schools?
Maybe.
I don't know, I don't think we.
Maybe.
Education
Let's-
provided to the school,
Yeah.
the schools themselves. So I understand what you're saying, like, as far as you're saying, like, do the parents not know that their school is that way? Like, there are a couple of private schools, so.
So it's 2 to 3 weeks and then it's a 2 series, so.
Maybe a use for the mobile unit to
Yeah, if we had
stage
to
on the
go.
street in front of the school. No, literally,
But
like
then-
if
and then the
you're, it was
pediatricians
just
now
some
have a-
literature.
Yeah, the pediatricians now have a protocol for people that want their kids extra immunized. So like when my kid was, I think it was 18 months, there was a measles outbreak at his daycare, a daycare in Hoffman Estates. So I got him an extra measles shot or MMR shot because he did not have all the titers. So I don't know, I don't remember if there was a protocol in place at that time. But the pediatricians have this algorithm now. So they're actually giving MMRs now to kids less than 12 months. They're giving them between 1 and 4 years old. So they have this whole algorithm now that I've seen.
They used to advise you do MMR before 6 months, like if you were gonna travel overseas to
Right.
some areas that had measles. So, I mean, before we had measles in the United States.
Yeah.
But now I presume like maybe, I haven't heard exactly what they're going with, but they did offer that before, like if you're gonna travel on a plane, so.
So it's not strictly 1 and 4 years old. If there's an increase of concern.
I don't know if that answers all your questions.
So if you have a baby younger than 4, you might want to get titers checked. See. I mean, and you definitely have to take them to the pediatrician and see.
Those of us who are ancient, like myself,
There has been that
Is
like
there-
kind of trepidation about the older age range, and I mean, you guys can speak to this too. I think you're in a good spot if you are immunized, but you can always check your titers to make sure.
Well,
If
do
you
mean
had
if you had
immunity,
measles, are you?
Did you have the
You,
measles? That's a
had-
good
I'm
point.
presuming she had, is what she's saying.
I don't know.
I don't know.
I
Did you
don't-
have the measles?
Barbara, what was
Dr.
your
Enzer,
question?
you had the measles?
so my question was, for those of us who are ancient, do we need to get another shot to boost our immunity, or?
if you ever had
had it
titers done, you should be immune for life, but
Doesn't hurt you to have one,
I don't think it hurts
well, it is a
you.
live vaccine, so
I know.
I'm not gonna commit to saying
Would
that.
step 1 be check your titers?
Yes,
I would say to check your titers.
but I think if you have
So
natural
when you're
immunity.
ancient, get your titers.
You probably had the measles.
You,
I
yeah,
mean, if you were old enough, you probably had the measles growing up. I don't know how old you are, and I'm not
Whoa.
going there. I'm not going there.
no, but when was the measles vaccine offered for the first time?
1964,
Okay.
I think.
I know that, like, I mean, I think at a certain age.
I gotta check that.
I know, I had
No, I think that was something else. No, that was polio.
What's next, Mr. President?
Yeah, yes.
I hope it was.
My mom had the measles when she was young.
Okay,
I'm gonna get you a gavel.
moving on.
The mumps.
Thank you for your report. Lots learned.
Dr. Tomaso, anything other than measles?
I didn't prepare anything else. 71.
Thank you.
1971.
Next,
See, I knew it. I always asked.
next item on the agenda is the consent agenda. Does any board member wish to have an item removed from the consent agenda?
I make a motion to approve the consent agenda.
And I second.
What is it on ours?
Motion's been made. Any questions or comments on the consent agenda? As it is a monetary issue, with the financial reports, I will ask for a roll call vote. The motion was made by Ms. Gaffney, seconded by Dr. Amsler, to approve the consent agenda.
Excuse me.
We ready?
Mm-hmm.
Okay. Ms. Gaffney,
Yes.
Dr. Amsler,
Yes.
Ms. Morosky. Yes. Dr. McGuire,
Yes.
Ms. Ortiz.
Yes.
Ms. Clark,
Yes.
Dr. Katz,
Yes.
Dr. Zurich,
Yes.
Mr. Markison,
Yes.
Ms. Carmen,
Yes.
Mr. Clark.
Yes. All those in favor, motion passed. Next item is item 8 on the agenda, contracts and agreements. 8A is Age Guide and Foundation for Aging Grant. Barbara, you want to speak on it?
Sure. Yes, I am ancient. Mr. Yes, I make a motion to
That was a good
accept.
humor.
That's all right.
Staff, does anybody on staff want to comment?
I think
I'll
Megan's
just
gonna.
make a quick, yeah, Melissa's been kind of serving on this, and then now I'm gonna do it. So we are gonna partner with Age Guide to work with them on their community health needs assessment. So we'll participate in their work group and help them develop some questions, and then do some social media, some marketing on that, and then participate in some webinars, and it comes with a little bit of funding. So it's a win-win, I think, for us.
So this funding that's not federal in nature, it's not
Coming from a private foundation.
private funding, okay, that, I saw that was the health
Well,
protection.
I didn't look, I didn't,
Institute,
it's, yeah, so Illinois Public Health Institute, they have these across the United States. They often are involved in a lot of training aspects for the state. They get contracts from the state. The MAP projects, so they do a lot of training, they're involved in a lot of research, so they get funding and then push out funding also to local health departments. So they receive the funding and are funding Age Guide to then work with the local health departments.
so that, I don't know if I heard Megan right, saying that you served on it previously, but this is a new contract?
Right, so this is like a development of conversations that we've been having, multiple local health departments from the northern region about how could we all work together to ask the same questions, just a couple of questions that would get at social connectedness. Because if we're all measuring it or involved in gathering that information, we have more information to use about aging in our community and how Age Guide can develop plans and, for aging in place or whatever it turns out to be, creating services and programs, because they're a large funder of social service or senior services across these counties.
Cool, perfect, thank you.
So who's our participant?
Megan is going to sit on the work groups now.
Oh, cool.
Fits very well with what we're doing.
Yes.
Good time.
Any board member wish to be recognized?
I'll make a motion to approve the contract for Age Guide Foundation for Aging Grant.
I'll second it.
Okay, any questions, comments from the board on the topic? Okay, motion
When you
was
get
made by
this old, I don't
Mr.
get
Markison, second by Ms. Gaffney. It's does have a little monetary connection to it, so we will do another roll call.
Okay. Mr. Markison?
Yes.
Ms. Gaffney?
Yes.
Ms. Clark?
Yes.
Dr. Zurich?
Yes.
Ms. Carmen?
Yes.
Dr. Amsler?
Yes.
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Mr. Clark?
Yes. Majority in favor, motion passes. Item 9 on the agenda, new and unfinished business, 9A.
So Patty has been working hard to update Article 2, which includes our pool barriers. So she's going to go over some of the proposed changes. We did have a meeting with the ordinance committee who already reviewed this. I can't remember.
Cecilia.
Yeah. So Patty, do you want to cover the proposed changes, or Cecilia, did you want to give a recap?
I think she can, she probably.
So we're proposing a couple changes. One is to correct the penalty section by referring it back to Article 1, which is our general provisions for the public health ordinance. And most substantively, though, we are proposing to change the ordinance so that pool barriers on pools located within municipal areas will be solely the responsibility of that municipality. Currently, we have the minimum standards for the county, but many of, at least half the municipalities have adopted the International Building Code, which offers options that we do not in the health ordinance. And then when pools in unincorporated areas are no longer compliant or no longer eligible for the variance or exemptions that the Division of Environmental Health oversees, those would then fall under the authority of the Department of Planning and Development for follow-up. Those are the changes.
All right, nice. Ms. Carmen?
I make a motion to approve the changes in Article 2.
I second.
Okay. Questions from the board? Motion has been made by Ms. Carmen, second by Ms. Ortiz, to approve amendment to Article 2 of the Public Health Ordinance. We can do a voice vote on this. All those in favor say aye. Aye. Opposed say nay. Ayes have it. Motion passed. Item 9B, employment contract. You have in front of you the employment contract. I will recognize Mr. Markison to speak on this.
I think everyone here has already seen this. It's come forth a couple times. We made a couple small corrections. This has gone to personnel in discussions, negotiations with the administrator, and we've reached, a tentative agreement on that. The recommendation from Personnel Committee to this Board of Health is to approve the contract as it is noted here, along with the resolution that goes with it. Does anyone have any questions on the document? I know we've already talked about this previously, and unless you want me to go over.
Well, for the record, I'm going to read the resolution.
Sure.
Resolution authorizing an updated employment agreement for the Public Health Administrator, whereas Melissa H. Adamson has served as the Public Health Administrator since 2018, and whereas the Public Health Administrator is appointed by the McHenry County Board of Health, according to state statute, and whereas the Personnel Committee of the Board of Health has reviewed and updated an employment agreement for the Public Health Administrator and recommends the Board of Health enter into the updated employment agreement with Melissa H. Adamson. Now therefore be it resolved by this McHenry County Board of Health of McHenry County, Illinois, that the President of the McHenry County Board of Health is hereby authorized to execute the revised employment agreement with Melissa H. Adamson, consistent with the guidelines established by the McHenry County Board of Health and its powers and duties prescribed by the state of Illinois, and be it further resolved that the updated employment agreement with Melissa H. Adamson, Public Health Administrator, shall be effective July 1st, 2025 to November 30th, 2029, and be it further resolved that the President of the McHenry County Board of Health is hereby authorized to distribute a certified copy of this resolution to County Human Resource Director and the Public Health Administrator, dated at Woodstock, Illinois, this 19th day of May, 2025.
Move to approve the contract to move.
Let me
Or do you want Kyle?
Does anyone have any questions? Any concerns?
He's the chairman of the committee.
I know hopefully everybody's seen this. You've had multiple opportunities. Okay. Then in that case, I'd like to make a motion to approve the resolution authorizing an updated employment agreement with the Public Health Administrator and the aforementioned contract.
May I second?
Yes, you may. Already got it done. A motion has been made by Mr. Markison, seconded by Dr. Amsler, to approve the employment contract with Melissa Adamson. This is a monetary issue, so we do need to do a roll call vote.
Mr. Markison?
Yes.
Dr. Amsler?
Yes.
Excuse me, Dr. Zurich?
Yes.
Ms. Carmen?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
Ms. Gaffney?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Ms. Borowski?
Yes.
Mr. Clark?
Yes. Those voted in favor, and the motion passed. Congratulations,
Thank you.
and thank you for your service.
Thank you.
Look forward to working with you. Okay, item 9C, staffing changes, reclassification.
Would you want me to speak to that? I'll start. So we had, in the IVCCP program, we had some vacancies and some changes. So we took the opportunity to look at what do we need, right? Reassess what would be most effective. So we had 2 part-time positions in admin specialists, doing admin specialist work. But the program is pretty intensive. It takes a lot of training and understanding and just scheduling and things. And we felt like after looking at that, combining the 2 positions into 1 position would be the most effective for the program. So that's what we've done. There could be 0 increase by doing this because adding health insurance is what really potentially increases the cost. So that's why in the resolution there is a range, because this is an unfilled position, would be an unfilled position. So depending on what that person comes in and needs, whether they're single, have no kids, there's 3 different packages to select. So I created some scenarios, and that's why you have a low and a high. Technically, it could be 0 if they are insured by a spouse. And I don't know, Lindsay, if you would like to say anything else?
I mean, it is 100% grant funded and we do.
Oh, I'm sorry, yes, and we're gonna put the increase, yes.
We are not necessarily paying for that, but
Yes.
it's a grant funded position. We are keeping the grant, I know. But if we did not have the grant, we would not have that position, just so that that's understood.
How long do you anticipate the grant running for?
I mean, I hope the grant continues to be renewed in the foreseeable, all the.
Well, we've had it, so again, it's the Illinois Breast and Cervical Cancer Program, so we have had that for
Many years.
2006.
Around 2006.
Okay, so it's not a separate segment of that, it's just part of the grant we've been.
Correct.
Okay.
It's part of that to both the Wise Woman and the IVCCP program. So just in order to achieve our needs, I mean, it makes more sense to pay an admin specialist to do admin work versus to pay the nurse to do that work. And then we really need the admin to set up the Nurses for Success to be able to do their work. And so
Totally.
it just makes more sense from an operational standpoint and staffing.
I'd like to make a motion.
Go ahead.
Approving the resolution authorizing the reclassification of positions 051-095307 and 0510973-19 to 1 full-time administrative specialist position from the Department of Health, fiscal year 2025.
I'll second it.
Okay, for the record, I'm going to, again, so we're all on the same page. The Board of Health, with this resolution, is recommending to the county board to approve this resolution. It's their jurisdiction to approve it. We are asking them to support our request. It's a resolution requiring supermajority, resolution authorizing the reclassification of position 051-0953-07 and 051-0973-19 to 1 full-time administrative specialist position within the Department of Health, fiscal year 25, in the departmental roster number 51. Whereas the Department of Health must be structured effectively to protect business and deliver mandated and essential services efficiently to protect and promote public health in McHenry County. And whereas the Public Health Administrator and the Director of Public Health Nursing reviewed operational resource and capacity needs within the nursing division and identified changes necessary to meet current and future deliverables. And whereas the department has recognized staffing within the nursing division to meet grant deliverables under the Illinois Breast and Cervical Cancer Program and the Illinois Wise Woman Program, and has determined that one full-time administrative assistant, number 1, position, grade 2N position is the best staffing model to deliver services efficiently and effectively, and whereas combining positions 051-0953-07, which was a half-time position, and 051-0973-19, which was a 3/4 position, results in a 25% reduction in full-time employment equivalency, and net savings of $3,063.37 in salary, FICA and IRF combined, but a potential overall increase ranging from $1,938.14 to $21,600.90, depending on health insurance selection, and whereas any increase in cost will be offset on the IBCCP and IWP grants, and whereas the resolution has been reviewed by the Director of Human Resources and Chief Financial Officer, and whereas reclassification outside of the budget process requires approval by appropriate committees and the county board, and has been reviewed by the Board of Health, the Public Health and Community Service and Administrative Services Committee, and it is being recommended to the McHenry County Board. Now therefore be it resolved by this County Board of McHenry County, Illinois, that it is hereby authorized the Director of Human Resources to make the proposed changes to the Department of Health fiscal year 25 departmental roster effective July 1st, 2025. And be it further resolved that the county clerk is hereby authorized to distribute a certified copy of this resolution to the Director of Human Resources, the Financial Officer, the County Administrator, and the Public Health Administrator, dated at Woodstock, Illinois, on the 17th day of June, 2025. The board meeting that this will be brought up in. Okay. We have a motion. Any further comments from the board? We have a motion by Ms. Gaffney, seconded by Ms. Clark. So we're going to do a roll call, please.
Ms. Gaffney?
Yes.
Ms. Clark?
Yes.
Dr. Amsler?
Yes.
Ms. Ortiz?
Yes.
Ms. Morowski?
Yes.
Ms. Carmen?
Yes.
Dr. Katz?
Yes.
Mr. Markison?
Yes.
Dr. Zurich?
Yes.
Dr. McGuire?
Yes.
Mr. Clark?
Yes. All those in favor? Motion passed. Thank you.
Thank you.
Next item is item 10 on the agenda, board issues. Any board members have any issues we should discuss?
I don't have an issue, but I just want, because last time I spoke about getting.
Federal issue.
Well, maybe, I don't know if you want to call it an issue or not.
You're out of bounds.
So I spoke about doing the, the county, not spending money on single-use plastic. So I spoke to Melissa, and she did speak to Peter Austin, and I spoke to Peter Austin as well. He's interested. He did talk to the chairman, and he's like, Mike Bueller, he's like, yeah, we kind of have to do better. So they're open. I'm trying to get a hold of, because I spoke when Lake County started in 2023, I had a meeting with the sustainability director there. And so I'm trying to get a hold of her again. I know people who work with her, so I can be like, hey, have her answer my email. So Peter's willing to sit down and talk to her and discuss, their barriers and their successes for not using plastic. So hopefully it's something that we can bring here to McHenry County, because we have enough plastic in our water already. So there you go. That's all I have to say.
Oh, okay. Dr. Amsler?
And Patty, you said your group has been working on this, wanted a little follow-up on the issue that
The issue from Huntley.
From Huntley, yes.
Oh, did you want me to speak to it, Melissa?
Sure. I mean, I can too. So again, I think my last update to the board, let me pull it up. It's in discovery right now. There is a discovery phase that the defendants' attorneys requested of the county. So we're in the process of providing the documentation that they have requested. And that is due middle of June? Does that answer your question?
So what is it they're trying to discover? Isn't it?
Well, I don't know that so there's.
It's illegal. That's like a legal term, meaning they're trying to.
Oh, yeah.
Push the court date. The defendants are trying to.
It's legal maneuvering, is that it?
Yes. Posturing.
Lawfare. Okay.
What we are required to do is, it's almost like it's similar to a FOIA request where there is a long list of documentation that they have requested that we need to put together and provide, and then they presumably review that information and I guess decide what next steps happen after that. I mean, there is a court date set in August.
Maybe I'm naive, but shouldn't the defendant already have a lot of that information?
Discovery is a process between both parties, though. They're preparing for litigation. It takes forever.
The role that the health department has done, they've done their inspections, they've given their reports, they've created the documentation. They've attempted to get voluntary compliance. They've got maybe some voluntary compliance, but not enough. So then it gets turned over, as one of the last resorts, it gets turned over to the court system. Once it goes across that threshold to the court system, the courts determine the timeline. And the procedures of litigation is the controlling factor. Our staff, other than responding to requests from the judge and requests from the attorneys, is limited to what additional actions can be taken until the courts decide.
Could we get the attorney to maybe come and speak with us?
The state's attorney?
Yeah.
We talked about having a state attorney just introduce herself to us now anyway, so.
Yeah, I don't know that they would talk about this in open session.
Okay. I mean, the people
But
came
we
and
can
spoke
certainly
with us, so now we're involved.
They have a moral.
Yeah.
So who can explain to us what's happening? Because now we're involved. These people talked to us about their children's mental health, so we feel like we're in this now.
The attorney may be able to.
And I know we can't.
And as this is active litigation, it can be discussed in executive session.
No, that's what I meant. If I didn't say open session, I meant to say they would not discuss this in the open session.
Ms. Markuson.
If I recall from our update previously, our last time we had an inspector out there on April 23rd or thereabouts, and it was about progress outside of the court hearing that is scheduled. Has there been any emergency, anything from the judge that has kept them out of the property? Or is there anything else from that date forward?
No, the court date is scheduled and we won't be conducting any inspections until very near the court date. So really, we're just pursuing,
Sure.
the legal process.
What is the current status? Are they allowed to be in the home?
We never, the Department of Health never issued any, we did not red tag the house. I mean, there was some confusion originally about that, but that was a Village of Huntley issue. So we have never requested that the house be vacated.
So we never requested it. Huntley, did they request it?
When our staff was out there, they did tag the house. But I couldn't, speak to that beyond that. I don't know exactly, the requirements exactly what that is.
The home's not currently condemned or?
Not to my knowledge.
Okay. And now it's in the court's hands?
Correct.
Those pictures were persuasive.
Where did you see that? Where did I miss that?
Yeah, the email.
There's pictures attached to that?
No.
No. So What pictures are you speaking of? We can talk later. This is not productive, I guess, for, no. I just feel like I've tried to look for more about that case and there's little public info on this.
I think anytime these things enter the court's jurisdiction, we become very cautious, and I'm expressing my own ignorance about it because I don't even know what's appropriate or what's not appropriate, and without having the state's attorney here to give us guidance.
I think that's the
It's
next
very
step.
difficult.
I think so
That's
too,
a
you're right,
good
because like I
point.
said,
Say-
these people have, I mean,
Norm used to come
Yeah.
to meetings.
Yes,
Right.
and we just, last week when we were at the I introduced Mr. Clark to the new state's attorney, civil division, Laura Scarry and Kyle Burnett. And so I will reach out tomorrow first thing and ask them to come to the next meeting and we can put this, or ask them if they're willing to come and speak on that topic. We can certainly ask them to come.
They've been asked to attend previous, haven't they?
Since they've been hired?
Yeah.
We,
I mean, they almost came to a
expressed a
personnel,
desire.
they almost came to a personnel committee meeting, right? That was-
Correct.
Yeah. So I will just formally say the board request that you come to the next meeting.
Yeah.
Both as an introduction and then if they can provide an update.
It is distressing to hear about
Yes.
this, what's going on, and have so little impact and being told it's in the courts. Anyways, enough said. You guys all know my heart on it, so. Sorry, Mr. President, I
Well,
apologize.
it's a fact, it's in the courts, and the courts establish their own timetable. And which is, almost everybody in society can be a frustration, the court's timetable. But that's how that system works efficiently. Okay, any other board comments? Was your question answered?
Yes, I wanted an update on it, and as I understood, the respond will bring the state's attorney back to give us an update on what's happening.
Can you just refresh my memory? I know we voted to have a budget for recognition. Where is that at? I mean, what are we doing annually this year? It's already,
Yeah, we've already done some things and now I'm gonna struggle. So last week was employee recognition. Was it last week or 2 weeks ago?
2 weeks ago, I think.
Well, so the county did, hosted a lunch. We brought in breakfast, smoothies and bagels one day. The all-staff meeting, I think we used some of those funds for that, even though that's not like individual recognition. And we still have the milestones where people can go on Amazon, like there's
that's what I was thinking about that, so.
Yes,
okay.
so that's still part of the employee recognition, that they can go and select an item.
Cool.
If you want to know exactly.
More than a paper certificate.
Right, no, and it just, when we were doing this tonight, I
We
was
still have
thinking.
an employee recognition committee.
Right,
Yep.
okay.
That meets.
And then on that topic, they'll be working on the 60th year anniversary.
Oh, yes, thank
Which is
you.
gonna be a big.
So we've already.
See, I knew that was gonna come up, sorry.
Yes, so actually, one of Megan's employees has already been designated as the chair for that committee. And so they'll start to work on how we celebrate our 60th anniversary next April.
Do you need some board participation?
Sure, why not?
I volunteer.
Yay.
How are you with the baton?
Shotgun.
Yeah.
Okay, anybody else from the board have any issues they wish to discuss?
I see a lot of baton injuries, actually.
I'm actually a lot of color.
I'll make a motion
And he went like this. It's
to
kind of,
adjourn to executive session for the purposes of reviewing executive session minutes dated April 21st, 2025.
At
What's that?
8:12. Second.
You second? I second.
Kidding. No, I don't.
I'll let you do.
No, no.